Thank you. Next speaker will be Dr. Teper from Katowice, Poland, presenting ellipsoid zone of short photoreceptors in hemorrhagic AMD.
Good afternoon. I would like to thank organizers for this quick opportunity. We were curious. I think that we are all here because we love swept source OCT. And we were curious how often we can rely on swept source OCT when we look for the tissue that is behind the hemorrhage. And this is a situation where spectral domain is not good. So we checked our database for patients treated last year for, Richard Spade is here, for neovascular macular disease. And we found 19 of them with intraretinal hemorrhages, and then that's what we focused on. And we looked for possibility to determine integrity of ellipsoid zone of photoreceptors. And to our amazement, we could detect the integrity or not in this particular place in all patients. So it means that even in very distinct optical shadowing, we can look for ellipsoid zone. Of course, sometimes it's not present, and in some patients it was not related to hemorrhage itself, but to the atrophy or scarring that happened to this patient before in those places. And here we have a very recent and very dense hemorrhage, and you can see that despite optical shadowing, there is present ellipsoid zone of photoreceptor. It's not very distinct here, but it's there. And in this other case, there is no ellipsoid zone of photoreceptors at all, but what is pretty amazing for me, there is definitely quite big hemorrhage, and there is almost no optical shadow at all in this patient. So that's truly nice. Just in conclusion, swept source OCT is probably a procedure of choice for all patients with intraretinal hemorrhages, and of course loss of ellipsoid zone of photoreceptors is related to hemorrhages, but in some patients also to atrophy and scarring that happens to them before. So it's great that we have swept source OCT that truly can look further. Thank you.